Hello, everybody. So today we'll be looking at impact fractures for our capstone number 2. And then we worked on this as a part of group number 3 with Beatrice, me, Kieran, Roxy, Chris, and Malik.
So we are focusing on impacted fractures. Now we are doing one on the fourth metacarpal of your hand and the tibia. Now the normal functioning hand consists of 27 bones, has 8 of those account for the carpals, 5 account for your metacarpals, and the remaining 14 are your digital bones. Now your hand provides a lot of support and structure. It goes into flexion, extension, abduction, abduction. Flexion would be moving your fingers towards your palm, and extension would be moving your fingers away from your palm. Abduction would be moving your fingers away from your middle finger, and adduction would be moving your fingers towards your middle finger. There's a lot of local motion that goes on in your hand. It also allows for a lot of grips. Your metacarpals work together to provide a stable platform for your hands and muscles, whether that's gripping a pencil, gripping a steering wheel. There's a lot of grip strength in your hands, as well as dexterity, which enables precise movement of the ring finger and other fingers, and there's just a lot of stabilization. Now, like I said, the impact of fractures on the fourth metacarpal. I personally did break my fourth metacarpal. This is my x-ray. You have 5. The thumb is your first, then it's your pointer finger, your middle finger, and then your ring finger is your fourth metacarpal. I hurt it in a basketball game. I landed right on it, and the bones just came together, and that's how I got my impacted fracture. Second photo is like a day after I broke it, and you can see that it's already starting to swell. There's also like my knuckle is not very defined. Now, how does this affect the normal function? Now, first off, you're going to have a lot of pain and swelling. It's just an inflammatory response when you break something, specifically the joints. It's going to notice that something's up, so it's going to just start to swell, and you're going to have a lot of pain. So that will affect you doing things. You're going to feel it whenever your finger tries to do certain motion. It won't probably allow it to, or might hurt for you to try to do it fully because the bone isn't in a stable position. It affects 2 main joints, your metacarpal phalangeal joint and your carpal metacarpal joint. These joints all assist in basically flexion and different motions, abduction, flexion, extension, axial rotation, specifically for the carpal metacarpal joint. And then the MCP joint is the same thing. It helps you do a lot of different movements. When the metacarpal joint is impacted, you're basically going to have difficulty flexing and extending the finger, and for your CMC, you're also going to have an issue with mobility and flexibility in that fourth finger. And it's going to be very unstable depending on the severity of the fracture. Now, the muscles that are affected in this would be your flexor, digitorum, pondus, which is responsible for flexing the distal interphalangeal joints of the fingers. And an impacted fracture of this would affect the function and lead to a limited flexion of the fourth finger. The flexor digitorum superficialis, the muscle that flexes the proximal interphalangeal joint of the finger, that will also result in a decrease of flexion in the fourth finger. And then you have your rubrical muscles, which are the small muscles located in the hand, and they're responsible for flexing your MCP joint, which we talked about earlier, and extending the interphalangeal joints. That impacted fracture will interfere with the normal function of these muscles and lead to weakness and reduce control of the finger movement. And then in some cases, the extensor digitorum muscles is indirectly affected of the impacted fracture because of the changes in your muscle balance and your joint movement. So overall, even if it's just a very small fracture, it still affects a lot, and because it's just connected to a lot of two different joints. It's between 2 different joints in the finger, and there's just a lot of muscles surrounding it. So it will greatly affect the normal function despite how small the fracture is.
When it comes to treatment, most fractures heal well and result in few problems, but how long they take to heal varies depending on many factors such as the person's age, type of severity of the injury, and other disorders present. Usually, using pain relievers such as acetaminophen are used to relieve pain. In this instance, a medical cast is used, but there are many other cases that are just treated with a simple splint. But in worst case scenarios, surgically inserted metal rods or plates are used to hold the bone pieces together. When it comes to prognosis, there are a couple of factors that affect it, such as age, anemia, muscle strength, and the early mobility level and the fracture type that have been shown. For most fractures, the whole process can take up to 18 months, but in adults, the strength of the healing bone is usually at 80% of normal range by 3 months after the injury. Moving on to our next example, we can see the normal function of the tibia bone. Since it's the second largest bone in the body, it provides stability and it's also a weight-bearing bone, having the medial aspect bearing most of the weight. It is also the origin site for 11 muscles, which allow for extension, flexion at the knee, and allows for plantar flexion of the ankle. Since it's a long bone, it also assists with the production of red blood cells. For our example, you can see that the X-ray that we have used has an impacted fracture in the tibial shaft.
Alright, so next we're going to look at the muscular anatomy of the tibia. So in total there's 11 muscles connected to the tibia in some kind of manner, whether that be them inserted into the tibia or they are originating from the tibia itself. So we're going to start with those that insert onto the tibia. That'll be the sartalis and gracilis muscles. They're on the medial surface of the proximal tibia. The quadriceps femoralis connects via the patellar ligament. Then we're going to have the semimembranous muscle. It's part of the medial condyle of the tibia. And then we're going to have the semitendius, which is at the proximal end of the tibia below our medial condyle. And then we're going to have the popliteus muscle, which is at the posterior surface of the tibia. And then the muscles that originate from the tibia include the tibialis anterior, which is at the lateral surface of the tibia, the extensor digatorium longus, which is at the proximal half of the medial surface of the fibula, the soleus muscle, which is known as the calf at the soleal line or the head of the fibula, the tibialis posterior, which is at the posterior surface of the tibia, and then the flexor digatorium longus, which is the last one at the posterior surface of the tibia. We're then going to look at the disruptions of that muscle function when we do see a break, or in this case, a fracture, a transverse one within the tibia. We're going to see extreme atrophy of the muscle within the soleus, possible tears of blood vessels because of this bone damage, as well as possible tears of the surrounding muscle groups that surround and in some cases run through the area of the tibial shaft.
So as we talk about the impaired functions of a fractured tibia, two main points we want to talk about: decreased ability to bear weight and the inability to walk or stand. That is because the tibia operates as part of the appendicular skeleton, which is important for weight bearing and movement. Also, at the site of the fracture, you'll have a deformity in appearance, and that is because sometimes bone can be broken apart, and also because blood collects at the site of the fracture, causing swelling. You have a decreased sensation in the legs or feet, and that is because the disruption of blood flow can happen depending on how severe the fracture is. Also, we can talk about how the tibia is part of the ankle and knee joint, and if you cannot use the tibia, you cannot properly use the ankle or knee because the tibia connects to the patella to form the knee joint, and it connects to the metatarsals to form the ankle joint. In most severe cases, which is rare, you'll have a severance of the arteries of the veins that run along the tibia. You have coldness or loss of color in the feet. Again, that is because of the lack of blood flow below the fracture. And then, as I touched on before, you'll have the inability to operate the ankle properly. That is because muscles that run along the tibia are important for being able to flex or rotate the ankle. As we talk about the mechanisms, again, the tibia is part of the appendicular skeleton, which is important for weight bearing, important for movement, and important for structure. And what happens in a fracture, external forces create pressure and causes a break in the bone, which can cause the loss of movement and the loss of the ability to bear weight. So at the site of the fracture, you'll have a hematoma because blood vessels become exposed, whether the medullary cavity or the osteons. Once the blood vessels are exposed, they create the hematoma. The hematoma over time creates an external callus and an internal callus. And over time, those two things eat away at dead cells, dead bone cells, and they replace this hematoma with compact bone or spongy bone, depending on the site of the fracture. And then over time, the bone remodeling occurs, and then the new bone is healed, and then you'll have a little bit of a knot at the site of the fracture.
Slide 12 shows us the mechanism in which a fracture can be repaired, from the hematoma formation to the fibrocartilaginous callus formation to the bone callus formation and the bone remodeling. Slide 13 shows us how fractures are treated, from using of cast to also having surgery done. The treatment of a tibia fracture takes up to 4 to 6 months to heal completely. Sometimes surgery might be needed in the case of adults, and in the case of open fractures, we need thorough wound care and infection prevention so as not to get the wound infected. Rehabilitation and physical therapy are needed for regaining strength as they help in preventing stiffness around the area of the body. The prognosis of a tibia fracture means that you'll probably be unable to stand, walk, and pull weight on that leg. And like I said earlier, it takes 4 to 6 months to heal completely.